What is type 1 diabetes burnout? What is diabetes burnout? Feeling burnout because of diabetes can be different for everyone, but it can mean you stop taking care of yourself and your diabetes. For some people, this means skipping insulin doses or not taking your tablets. Some describe it as hitting a wall or giving up. How do you fix diabetic burnout? While diabetes burnout is common, there are ways to recover from it. Reduce your stress levels. 1. Exercise. 2. Get plenty of rest. 3. Talk with loved ones. 4. Connect with a mental health professional. 5. Avoid drinking alcohol or using drugs. 6. Take a break from things that cause you stress. Is there such a thing as diabetes burnout? When you feel discouraged and frustrated, you may slip into unhealthy habits, stop monitoring your blood sugar, even skip doctor's appointments. It happens to many, if not most, people with diabetes, often after years of good management. You're in the land of diabetes burnout. How does type 1 diabetes affect a person emotionally? People with type 1 diabetes are at a heightened risk for mental health issues, including diabetes distress, depression, anxiety, and disordered eating. However, these are all treatable disorders. It is important to pay attention to your feelings about having diabetes or taking care of someone who has diabetes. What emotion is attached to diabetes? Diabetes distress. Sometimes people feel distressed, which can include feeling frustrated, guilty, sad, or worried. It's understandable if you feel this way from time to time, you're not alone. What is a diabetic rage? What's sometimes called diabetic rage can be dangerous, because it may involve behaviors you're not consciously aware of. When your blood sugar fluctuates, spikes, or drops, it can produce feelings of anger, anxiety, or depression. You may feel like your emotions are out of your control. Can type 1 diabetics get disability? The short answer is yes. Under most laws, diabetes is protected as a disability. Both type 1 and type 2 diabetes are protected as disabilities. Can diabetes cause mental breakdown? People with diabetes are 2 to 3 times more likely to have depression than people without diabetes. Only 25% to 50% of people with diabetes who have depression get diagnosed and treated. But treatment, therapy, medicine, or both, is usually very effective. And without treatment, depression often gets worse, not better. 03. What benefits can a type 1 diabetes claim? Type 1 diabetes can qualify as a disability under the ADA if the disease is having long-term, debilitating effects on the person's body. In this case, the individual may be eligible for reasonable accommodations from their employer to continue doing their job. Can being diabetic change your personality? You may think diabetes just affects your pancreas, but living with this condition often affects your mood and mental health too. For one, you may experience mood swings when your blood glucose levels are too high or low. Stress, depression, and anxiety can also crop up. Can diabetics get a hard-on? Men with diabetes are 3x more likely to have trouble getting or keeping an erection. There can be several reasons for this, such as limited blood flow, nerve damage, neuropathy, and damaged blood vessels. It can also be down to medication or just how you're feeling at the time. Thanks for watching. Please subscribe if you liked the video. Let's continue later.